So let me talk to you about the 5 most severe liability claims that you're likely to see in a mental health, substance use disorder, or intellectually and developmentally disabled service provider environment. First, fatality. I talk about this all the time with my substance use disorder programs, but the most likely ways you're going to get wrapped into a lawsuit have to do with suicide and overdose in your programs. So it's not a surprise to me to see this on the list of the most severe, the biggest claims that you're going to see. 2, alleged sexual misconduct. 3, alleged abuse and molestation. So let me make a distinction here between sexual misconduct and abuse and molestation. Sexual misconduct is what it sounds like. It's intercourse. Abuse and molestation may be giving someone a nasty nickname or beating them up or bullying. This is something that you can see in an environment for the intellectually and developmentally disabled. 4, alleged negligence. So this is going to be lack of care. Sometimes in environments for the intellectually and developmentally disabled, what you'll see is somebody goes missing and shows up at the bus stop 2 miles down the road. Well, thank God that person didn't get hurt, but what if that person gets hit by a bus? It's a real issue. It's real important to think about. And then 5th, alleged wrongful death. It kind of makes sense that if we're talking about big claims, the ones that are going to be big are where somebody gets really, really hurt. And when we're talking about mental health environments, sometimes people die. Let's talk about what you do about these things. It comes down to 2 key things for the severe liability claims. It comes down to lack of oversight, and it comes down to sexual misconduct. So it comes down to supervision of your people. Make sure you have a strong abuse and molestation prevention program and strong program policies so that you know what your employees are doing, you know what's going on, you know that they know what to do and how to report it and how you're going to respond if something comes up. Just going back to the types of claims we're talking about wrongful deaths, we're talking about overdose, we're talking about sexual and physical misconduct. This all gets down to the quality of your programming and your level of oversight into what's going on. So if any of this is making you ask some questions about your insurance program and how it might respond, whether you've got enough coverage and you want to talk to somebody that is qualified and has experience in your field, reach out to us at www.bitnerhenry.com and request a quote. I'm Daryl Henry with Bitner Henry Insurance Group, and we serve those who serve others.